Good evening. My name is Trevor Seabrook. I am a nursing student at ECPI University, and today we're going to discuss the role or importance of oncology nurses. Just to get directly into it, the American Cancer Society estimates roughly 1.9 million new cases in 2022 in the United States, and that goes with roughly 609,000 deaths that are projected in 2022 as well, and that does not take into account the effects COVID has had or will have for the rest of this calendar year. So, oncology nurses do deal with both hematology and oncology, but today we're going to focus solely on medical oncology in the outpatient setting. Cancer today is the second leading cause of death in the United States, only behind cardiovascular disease. Oncology nurses do serve a wide range population, which is going to be your pediatric, adult, and geriatric populations. And one of the main nursing focuses, I should say, is going to be ADPI. So, medical field loves their mnemonics, and this is a very famous one. But we're going to touch on a little bit of each step throughout this presentation. But this is the assessment, diagnosis, plan, implementation, and evaluation of nursing. Today we're going to focus on four parts of the nursing process, or four duties that oncology nurses will undergo on a daily basis. First is the new patient process. Then we'll discuss a little bit about the triage process, the daily day-to-day activities of triage. We'll also get into the coordination of care, which is a very big deal because oncologists are going to be in constant communication with other specialties. And then lastly, we'll finish up with the administration of chemotherapy itself. So when a patient is first diagnosed with cancer, it's obviously a very critical time. It's a life-changing event. And you want to make sure from that moment on, as a nurse, you are constantly educating the patient. You're in constantly teaching them about any potential side effects, what to expect, any questions that need answering regarding their specific plan of care. You also may be involved in emotional support as well, and that could either be with the patient themselves or also the family members. So you really want to look at this as a multifaceted approach. From the time the patient is diagnosed all the way to end of life care or hospice care. So that educational process continues after that initial diagnosis into the consent process. So that patient who's just been diagnosed, if they're going to undergo treatment, they are going to have a consent appointment. That is also a chance for them to get any questions answered that they may have. And so I've included one of these educational handouts here, something that a patient may see, just a quick blurb about what to expect during chemotherapy. So it just kind of gives you some information there for a patient to take home. So after that consent process happens, then we get into treatment planning. So that is scheduling the actual treatment. You're verifying a lot of information that may already be there. You're going to be doubling, tripling the checks on everything that's about to happen. One, to also reassure the patient, obviously in such a critical time, that we're doing everything that needs to be done. But it's also a very complicated process, just because of some of the chemotherapies that we encounter. It may be day 1, day 8, every 21 days. So a lot is going to go into the actual scheduling process of treatment as well. So I did include another two slides here that discuss the example I used is a drug called capecitabine. This is from chemocare.com, something we may print out and give to a patient for them to look over. So you'll see here what is capecitabine, how is it given. We'll also really go into the side effects, what to expect. We'll get a list of more common side effects, which are which are side effects that occur in greater than 30% of the population, and then also ones that are less common that occur in less than 30% of patients. So after that, that patient is initially diagnosed. One of the other things, the main things, and spend a lot of time throughout the day going over triage messages and new calls. So symptom management is a really big thing for nurses. You'll have to follow up with patients post-treatment. You will get messages coming in from patients post-treatment, or say a patient's off treatment and wants to go back on. So you'll get a lot of those messages throughout the day, and you really have to assign importance or a level of urgency to each individual message to decide what needs to move to the top of the list and what isn't. So there'll be medication management, patients calling in for refills, interactions. Patients will let you know, hey, I've just been put on this kind of drug. Is that okay? So those are just a few examples of some of the triage and counseling that'll take place on a daily basis, really. I've included just an example that I made up myself. Now, this is Dr. LeBron James's patient. Jane Doe is calling. Her daughter is actually calling to let the nurse know and physician know that the patient has been experiencing nausea. And this message was forwarded to Jessica. Jessica answers the message and very clearly documents the problem. So that's a very important piece as well. And then also the coordination of treatment is very important as well. And I included this photo here of Camp Phoenix, which is more of a retreat for cancer survivors. But I think we all, as time goes on, are putting more focus on the mental health aspect of oncology nursing and oncology in general. And so I've included this photo here, but other coordinating efforts would include consultations with outside physicians or specialties such as pulmonology, cardiology, and then we'll also have maybe testing laboratories that will communicate with DME companies or durable medical equipment companies. And we also want to share as much information with those folks as well. So if you are in communication with a pulmonologist and you have some new testing that's just come back, you want to make sure that they're aware of what's going on as well. Now, with the chemotherapy administration itself, depending on your role in that particular office, that will dictate what your responsibilities are. But just a few examples of that would be your daily treatment schedules. So you would get assigned sometimes quite a few patients for that particular day, but you'll review that patient's history. Make sure you provide enough time to educate that patient, let them know that they will be observed very closely throughout that time and each time that follows. You're going to do a lot of dosage calculation and verification. So you'll see multiple nurses coming over to kind of double check each aspect of that particular treatment. And then the most important thing, which I've underlined, exclamation mark, bold, is documentation. So documentation is very important. A lot of nursing students will hear, if you did not document it, it did not happen. So yeah, that's a very important step. And something that an oncology nurse has to be very educated on and how to do that. So I know we covered a lot of information. I've ended again on this picture here, which just kind of underscores the importance of educating patients. But with all of that information said, my question to everyone here is, do you think this is something you can do? Or more importantly, would it be something that you'd like to do? So I look forward to any comments, questions that you may have. And I just want to thank you all for taking the time to listen. Have a good night.